Hello, welcome to the Boston Sports and Shoulder Center. My name is Andrew Jawa.
And I'm Jacob Kirsch. We're the two surgeons that perform shoulder replacements. If you're watching this video, you may be a candidate for a shoulder replacement.
The purpose of this video is to first go over the basic anatomy of the shoulder. Second, it's to help you understand the difference between a reverse shoulder replacement and a regular shoulder replacement and which one may be best for you. And lastly, it's to go over the benefits of shoulder replacement surgery, decreasing pain, improving motion, but to also talk about the risk and the complications that unfortunately can be associated with surgery.
Lastly, we want you to hear from two of our patients, one who had a regular shoulder replacement and the other who had a reverse shoulder replacement. At the end of the day, having a shoulder replacement is a very personal decision, and it's all about weighing the risks and benefits.
So let's go over the basic anatomy of the shoulder. This is the model of a right shoulder. So if you're looking at me, this is my right collarbone, this is the right collarbone in the model. This is the arm bone, and this is the shoulder blade. There are two layers of muscle before you get to the shoulder joint. There's one big layer of muscle called the deltoid, which is on top, which is this muscle. And then there are four muscles underneath there. 1, 2, 3, 4. These four muscles collectively are called the rotator cuff. It's called the rotator cuff because each of them rotates your shoulder, and in the body they all blend together to create a cuff of muscle like a sleeve cuff. Now, underneath the rotator cuff is your shoulder joint, and that's the focus of what we're going to be talking about today. This blue stuff is called cartilage. Cartilage is unbelievably smooth and it has no nerves. Unfortunately, it could wear down, and when it wears down, the bone underneath can rub on bone. And that hurts because bone has nerves in it. Additionally, you get stiff because bone is very rough while cartilage is very smooth, so it limits your motion. This process of the cartilage wearing down, the bone rubbing on the bone, the pain, the stiffness, that collectively is called arthritis. The major driver in getting arthritis is mainly genetics. It's called osteoarthritis. But there are other reasons you can get arthritis. You can get it from trauma or fractures. You can get it from diagnoses called rheumatoid arthritis. Now, other things that we have to consider in the anatomy is the rotator cuff. The rotator cuff can tear where it attaches to the bone. And when it tears, it can pull back. It pulls back because there's some elasticity in the muscle, like a rubber band. And it can even lead to a second one tearing in the back. If these tear, and if they've been torn for a long time and they pull back, the ball can migrate upwards of the shoulder joint, and it can eventually rub up against this bone up here, which can hurt and actually can lead to the wearing down of the cartilage up top. Additionally, if the cartilage has been worn down for a while, it can actually wear down into the cup, which we call the glenoid, and it can really distort the anatomy and affect our ability to do a shoulder replacement. And we take in consideration all these anatomical factors, the rotator cuff, the erosion into the bone, how much the cartilage is left, in making the best treatment decision for you and your family.
After a patient is deemed to be an appropriate candidate for a shoulder replacement, there are generally two replacement options that we consider. The first is called an anatomic shoulder replacement, and the other is called a reverse shoulder replacement. Either Dr. Jawa or I will have an individualized discussion with you regarding the overall condition of your shoulder, as well as both your short-term and long-term functional goals, so that together we can come up with a treatment plan that's most appropriate for you. The first replacement option we're going to talk about is called an anatomic shoulder replacement, and this is a model of an anatomic replacement. It's called an anatomic shoulder replacement because we essentially replace the worn-out arthritic bony surfaces with components that look like what your normal anatomy was supposed to look like without arthritis. For instance, we replace your humeral head, or the ball of the ball and socket joint, with a metal humeral head that looks like what the normal anatomy is supposed to be like without arthritis. Additionally, on the glenoid or the socket side, we replace your worn-out socket with a medical-grade plastic socket, so that after an anatomic shoulder replacement, you have metal rubbing on plastic, so the surfaces are very smooth and it improves your range of motion dramatically. When you think about an anatomic shoulder replacement, it's most similar to thinking about changing the tires on a car. We replace the worn-out surfaces with new ones that have the same design and function, However, we don't do anything to change the motor or what powers the car. In the shoulder, the thing that's most similar to the motor is the rotator cuff. One of the most important functions of the rotator cuff is to provide stability to the shoulder, and in conjunction with your deltoid, allows you to move your shoulder and your arm. So it's very important that in patients where we're considering an anatomic shoulder replacement, that they have a good quality rotator cuff. Overall, an anatomic shoulder replacement is an excellent option for patients with a good quality rotator cuff who tend to be a little bit younger and more active. Approximately 80% of patients who receive an anatomic shoulder replacement can have that replacement last at least 20 years. The next option we're going to talk about is called the reverse shoulder replacement, which really has been one of the biggest innovations in the world of shoulder surgery. It's called a reverse shoulder replacement because unlike the anatomic replacement, with the reverse, we actually take the ball and put it on the socket side, and the socket goes on the ball side. So the components are actually reversed relative to what your normal anatomy is. Now, the main reason a reverse shoulder replacement was designed this way is to provide stability to the shoulder and compensate for a deficient rotator cuff. So for patients who have a large rotator cuff tear, they'll often go to lift their arm and the humerus will translate upwards. And this can result in very limited function and often be very painful. So it's the very design of a reverse shoulder replacement that stabilizes the shoulder and prevents the humerus from translating upwards and allows their deltoid to move the shoulder and their arm. Generally speaking, there are 4 main scenarios where we consider using a reverse shoulder replacement instead of an anatomic one. The first scenario is when there is either an irreparable rotator cuff tear or significant rotator cuff disease in the setting of arthritis. In this situation, the reverse shoulder replacement compensates for the deficient rotator cuff and also alleviates the pain associated with arthritis. Another scenario where we may use a reverse shoulder replacement is when there is really significant bone loss or deformity on the socket. Some patients have very severe arthritis and will actually wear down and erode the bone on their socket. And in some instances, it can be so severe that it potentially compromises the functional outcomes and implant survivorship with a regular shoulder replacement. So in certain instances, we may use a reverse shoulder replacement because we're able to get better fixation on the socket side using the specialized base plate and screws as opposed to the regular plastic socket. A third scenario where we may use a reverse shoulder replacement is in certain fractures of the shoulder or proximal humerus. In some instances, it may be more predictable to actually replace the shoulder as opposed to try and fix the fracture. Lastly, another scenario where we may use a reverse shoulder replacement is when we actually have to revise a previously done shoulder replacement. Now, this isn't always the case, but often it is more predictable to do a revision replacement using the reverse as opposed to an anatomic replacement. Overall, reverse shoulder replacements are an excellent option for patients with a variety of shoulder conditions where an anatomic replacement may not be ideal. Over 90% of patients who have a reverse shoulder replacement will have that replacement last at least 10 years, and there's newer studies coming out that show that the reverse shoulder replacement may last longer than the regular replacement. Either Dr. Jawa or I will have a very individualized discussion with you regarding the overall condition of your shoulder, as well as your functional goals, so that together we can come up with a treatment plan and decide which replacement option is most appropriate for you.
Next, let's talk about the benefits as well as the risk of surgery. So shoulder replacement surgery is a great operation. I love my job because patients really do well. It decreases pain dramatically and also improves patients' range of motion and function. It doesn't make your shoulder perfect or normal. For patients who start here, they'll get your arm to about right there, sometimes a little bit higher, and if you start here, you'll probably get up to there. For about 50% of patients, their pain will be 0. They won't have any pain. The other 50%, they'll say they'll have a 1 or 2, but it's dramatically better than where it was before surgery. So there's 6 complications that I talk to every patient about. Some apply to you and others don't, and we'll talk about that individually in our consultation. So there's a risk of infection. Nationally, the risk is about 1 in 100. Mine is about 1 in 1,000, so significantly less than that. But the people most at risk for infection are actually males under the age of 60. That might sound counterintuitive, but the reason is because the type of bacteria that causes infection lives in sweat glands. Men below the age of 60 have more sweat glands than women above the age of 60, for instance. So they are at the highest risk of infection, though still quite low. If you do get an infection, it's a really big deal. Everything has to come out, has to be cleaned out, and it can lead to multiple surgeries. So it really is a big deal, and we really want to avoid it. We try everything we can to decrease that risk, but sometimes it is, unfortunately, just bad luck and demographics. The second risk are medical issues, heart attacks, strokes, things like that. Very, very uncommon, but is directly related to your medical health ahead of time. Next is pain. This surgery will help your pain dramatically. 50% of the time it gets it down to 0, but it's not uncommon. About 50% of the time people say, I have a 1 or 2, but it's much better than before surgery. 4 is nerve injury. Nerve injury is a really big deal, but uncommon. So what happens is in arthritis, most patients are really stiff. During surgery, we have to take a muscle off like a hood of a car, bring your arm to the outside, do the replacement, and bring it back. And in doing so, we stretch the nerves that go to your hand. Nerves are like rubber bands though, and they're stretchy. But the problem is as we get older, the nerves become less stretchy, and they're like rubber bands that become brittle. So if we stretch them more than they tolerate, they can be injured or damaged, and that can lead to permanent numbness or weakness in your hand. It could be a really big deal, affect your ability to hold things or drop things or always have numbness. The good news is it's very uncommon. It's about 1 in 300. It does affect women, typically above the age of 75, more than others, but it's still relatively uncommon. Next is a risk of dislocation, popping out of socket. This is also quite uncommon. My rate is about 1 in 1,000, and the key is for the first 6 weeks, you have to be in a sling. You can type, you can write, you can use fork and knife. You just can't bring your arm to the outside and behind your back, and we'll review these. Lastly, there's a risk of a stress fraction, a bone up top called the acromion. This happens about 1%, and it's mainly in reverse shoulder replacement. And it happens in patients who have softer bone. It likely is related to overdoing it in the first 3 months after surgery, usually in patients that are doing really well. So we want to go really slow with therapy. If that happens, you do have to go back into a sling. People don't love that, but it typically does heal. So big picture, shoulder replacement surgery is a great surgery. It really helps people dramatically, both in pain and function, but there are risks, and it's about weighing the risk and benefits.
I'm Ken Fisher. I'm a little over 78 years old, and approximately 1.5 years ago, I went through a total shoulder replacement of my right arm. After extensive activity in the sports world, my shoulder just wore out and I was having severe pain. It was very difficult for me to raise my arm above my shoulder, very honestly, or to even sleep or whatever on the right side. Everybody understands there is a risk in anything that you do. I knew I couldn't live with what I was doing, very honestly. If you go through this, then mentally prepare yourself to do some real good rehab, 3 months, and maybe for some a little longer. I am active again. I can play a decent round of golf. I can still bowl very, very well. It was beneficial for me, and I think it would be beneficial for anybody else with the right mental attitude. At this stage, I'm happy to go through any type of exercise program or any type of flexibility movement with the right arm, very honestly. Muscle-wise, range, up and down, sideways, cross, it doesn't make any difference. My arm is perfect. That's all I can tell you.
My name is Abby Peterson Young, and the procedures I've had were both my arms done a year apart. I couldn't sleep on my stomach, I couldn't sleep near my shoulders, I couldn't lift up and get a plate for dinner, cleaning the house, very basic stuff, just, it hurt. It just got to the point where the pain was just extraordinary. Searched for a doctor and I found Dr. Jawa. The first shoulder that we had to work with right away because it was just incredible, unbelievable pain. It was really pretty, it was awful. So a year later, they did the left shoulder, which was getting, incrementally was just getting worse. So he took care of that shoulder and my rotator cuff as well. So it was 2 surgeries within 2 years. The thing that Dr. Jawa said that I was so appreciative of, he said, you know, Abby, I can't promise you full mobility, you know, because everyone's different, and I have full mobility. I have no pain. I don't even remember what the pain felt like. I knew it was bad, but I like that it's gone.
A shoulder replacement is an excellent operation and really dramatically improves patients' lives, both improving their pain and function. But ultimately, it's about weighing the risks and the benefits and deciding what's most appropriate for you.
We're here to help you make that decision for you and your family. So thank you for watching this video. If you have any questions or concerns, please reach out to us.